Hello, I'm Dr. Arthur Rosner, and I'm an ears, nose, and throat physician or otolaryngologist. I treat both children and adults. Today I'd like to share with you new information about using some of the sinus balloons to dilate the sinus openings. For many patients, they have sinus headaches. This can also be accompanied by chronic infection. And when patients get infection, they can have excruciating pain over their maxillary or frontal sinuses. In the past, we would see people with deviated septums and fix their septum, but if their CAT scans were relatively normal, we didn't have much to offer other than medicines. New technology using the sinus balloons has come available to perform minimally invasive dilation of the frontal and maxillary sinuses, and this can be done either in the office or the operating room. Many patients with sinus headache or pain respond very well to this type of treatment. Patients come in and talk to us about the pain and pressure they have in their face. It's important to note whether these symptoms bother them at night. I am also double boarded in sleep medicine, and I've learned that during REM or dream sleep, the nose gets congested. When that happens, the sinus openings can block and cause discomfort, which can wake the patient up. Patients are typically evaluated in the office. They've typically been tried on medications first. When this doesn't work, a CAT scan picture is done to evaluate the sinuses. Patients are also given a questionnaire called a SNOT, or Sinonasal Outcome Treatment Questionnaire, and this to help elucidate the symptoms that patients have. Once we determine that patients are a good candidate, then they're set up to have a balloon procedure done either in the office or the operating room depending on their pain tolerance and their specific insurance. Typically what's done is after the nose is either numbed in the office or patients are asleep, we have a guide wire shown here, and this is hooked into a light source, and we can see when the sinus lights up that we're in the appropriate spot. The sinus balloon is then advanced into the sinus and then dilated. And so when this happens, we are able to stretch the bone in the sinus, relieving blockage of the narrow spots that can cause pain, chronic sinusitis, and infection. When the procedure is done, the balloon is deflated and the wire is brought out through the nose, and patients have a minimal recovery. Recent research by me presented at the American Rhinologic Society showed that sleep and sinus seem to go together. And what we found is that when the sleep is disrupted from sinus pain or other disorders such as narcolepsy, there are chemicals in the body called cytokines that are elevated. These chemicals, when they are elevated, further disrupt sleep, increase sinus pain, and these same chemicals are also the first precursors to bacterial sinusitis. So when the sinuses are ballooned or dilated, people find that they sleep much better, their facial pain is better, and because of their improvement in sleep and inflammation, they find they get sick less with less colds and less episodes of sinusitis. We are also starting to use the sinus balloons in children for those children who also have chronic episodes of sinusitis. This is often done with an adenoidectomy. When these are combined together, the success rate is significantly better than just doing an adenoid alone. Prior research showed that an adenoidectomy for sinus infections worked about 50% of the time. But when the maxillary sinus openings are also ballooned at the same time, the success rate for clearing up chronic sinusitis in children is 80%. So if you or one of your family members has chronic sinus pain, or you have a child with chronic sinus infections, we would love to evaluate in the office and see if we can help you.